Welcome back to Pain-Free Lifestyle. I'm Dr. Joshua Cohen, trigger point specialist. Today, we're going to talk about how to treat jaw pain and headaches at home. It's very possible, it's very easy to do. A lot of times headaches come from people clenching their teeth, their shoulders coming up to their ears, and it tightens up that whole complex, your jaw, your neck, your shoulders. I find that if you get headaches and you clench your teeth, you're not going to be able to get rid of your headaches unless you take care of your jaw irritation, the muscular irritation in your jaw, specifically the muscles that attach to the TMJ or the temporomandibular joint. So the muscles we're going to talk about today are the temporalis muscle, big fan-shaped muscle on the side of your temple, masseter muscle, right on the side, big massive muscle on the side of your mandible, and then we're going to do the medial and lateral pterygoids, which are on the inside of your mandible. So to start out with, you have your jawbone, which is shaped like that. It's all one bone. It's not two bones, just one bone. And on it you have your mandible, which are the parts that stick up and attach into the TMJ. That's a part when you open and close your mouth, it's moving. So you have muscles on the inside of that bone, just like you have muscles on the outside of that bone. They all control the TMJ and your jaw. So the first muscles we're going to treat are the masseter muscles. They're the big muscles just on the side of the jaw. I'm going to stand on this side. If you start on what's called the inferior, posterior border or angle of the mandible, or the very far back and bottom part of the mandible right there, just come up from there, and you want to press on both sides. You can use your thumbs, you can use two fingers, I like to do that. Work all the way up to your cheekbone or the zygomatic arch, but you don't want to come too forward. You want to stay on that jawbone back here. You want to find the most tender spot and press on it. Hold it for 5 to 10 seconds and then release it. Once you do those muscles, now you want to move up into the temple, into the temporalis muscle. It's a big muscle that's about this size. So you want to start right in front and on top of the ear and work your way up. And as you find a spot that's sensitive and tender, press on it. And press on both sides, so you're kind of pressing in against the head. So you have those two muscles for temporalis and masseter, so you're doing them on both sides. And now we're going to do the medial and lateral pterygoid muscles. What you're going to do is you're going to take, so it's a muscle that's on the inside of the mandible, but way up on top, in back, as far back as you can go, behind your molars and up top, pointing out towards your ear. So the way you're going to do this is you're going to take your palm. So we're going to treat the left side. I'm going to take my right hand, palm out, index finger pointing that way, and I'm going to go into my cheek. I'm going to go into my jaw. If your finger's poking out of your cheek, you're not in the right spot. You want to be back in by the mandible, pushing your finger up along the side, and then going up into that little pocket. And what it looks like is this. Right there, and you're pressing up and back towards the ear. It is an exquisite pain. It's one of the most tender trigger points in the body. Chances are you'll be able to reproduce some of your headache-like symptoms by doing these muscles. If you can, that is a good sign. Have a pain-free day.